As I mentioned in my previous segment with Pat White, the athletic director from St. John's, the sectors of the economy that create jobs and provide important services, education is number 2, but number 1 is healthcare. Mm-hmm. And Notre Dame Healthcare is an important player in that space, and I'm pleased to have with us Tracy Larson Benvenuti, who's with us, and Patricia Thibealut. Welcome. And we were kind of talking off air. It just seemed like you were both here yesterday, but it was actually in 2016. And at that time, you were just launching a new program, which we'll get into in a moment. But for those that didn't see that episode 3 years ago, maybe you could, either one of you can jump in, or both, talk a little bit about how long Notre Dame Healthcare's been there, and where it is, and how many people.
What we're doing.
Yeah.
Well, Notre Dame Healthcare has been in this area for, we actually just celebrated our 25th year. So we've been a continuum. It's on Plantation Street, so a lot of people are familiar with that area. They're familiar with the buildings. Typically, they'll know somebody who lived in either the long-term care that we have or the assisted living. What a lot of people don't realize is over the years, we really have expanded. There's an educational bridge center, so we work really strong in the community to help in a lot of different demographics, a lot of different areas with free educational courses. We offer HiSET, which is they used to call the GED, and we have English for the workplace. We tutor folks who are taking citizenship tests. We try to sponsor. And so the students come and they get passes. We have computer room, education rooms. So that's kind of like, why would they do that? But that is part of being Notre Dame. It's steeped in tradition, and the Sisters of Notre Dame de Mer were an educational order, so they bring that. So even in healthcare, there's a lot of educating the staff for retention in our buildings, the long-term care and the assisted living, and even in hospice, we've had folks go through that system and become LPNs, and then go on to be an RN.
And then even as we've talked about before, and with Karen, the recruitment of employees. I mean, as a city with in a region that's historically and to this day immigrants and people wanting to come here for opportunity, healthcare is a great career. Absolutely. But having that GED, English,
it's really important.
And if we did not have the immigrant population, the healthcare system in Massachusetts and probably around the country would stop tomorrow.
And it helps with turnover, because that is a difficult part of the segment of healthcare, and turnover is a big part of that. So and we take students from our local colleges, and we have a lot of interns that we have. We also have they'll come in and they will follow our nurses, follow our social workers. We work with all the major colleges in the area. They've invited us to come and speak to their students about what we do. And so at the at-home division, which is Tracy, where Tracy and I work, we're in the community. So we have all that great stuff going on, on Plantation Street, but what people confuse and what I have really worked hard in doing in the last 3 years is to be as much in the community to let folks know that our hospice, our palliative services are there for them where they live.
And we talked a little bit about that last time, and again, I think the team at Notre Dame kind of ahead of the curve, or trying to increasingly a lot of focus with ACOs and others about delivering healthcare where it's needed, not always in the facility, whether it be a hospital or a nursing home, as it may, some might know it. And as much as you've got a beautiful campus with a mix of some classic buildings and some newer buildings, you were at the time, I think, kind of launching kind of a lot of the hospice and the home care.
We were launching a new palliative program to complement our hospice. So the hospice has been in the community for 10 years. But we have really grown. So we're in 44 towns throughout Central Mass. We go all the way out to the Brookfield area, Leominster on the west. To the east, we're Marlborough, that whole Hudson Valley. North, Harvard, going up that way. So we really go pretty far outside of just, Worcester. And so we were chosen to run a pilot program through Medicare. And we're one of two. There were only 2 hospices in Massachusetts chosen, and the other one is in the Boston area. So there's really just that metro area, and then here in Central Mass, there's us. There weren't even any chosen in Connecticut, so it's really something that's we're very proud of it, and it's because I think we are able to, as a nonprofit, as a community-based organization, because we are so entrenched in the community. We really we're not a giant wheel. We can kind of make ourselves into what we need to be to service the community, and that's Tracy can talk about where we've come in the last year with that program specifically.
Jump in, Tracy.
So the Care Choices program is a pilot program that was started through the Center for Medicare and Medicaid Services, which is where we get our payment source from. And the idea of it is to really CMS, the wonderful CMS. So the
large payer source.
Any healthcare provider, CMS, and that's funds a lot of the work.
It funds the work that we do. The wonderful
federal government, taxpayers at work, right?
The wonderful thing about the federal government right now is that we're starting to see that patients are entering into their hospice benefit a little bit too late, and that with earlier detection and getting the psychosocial services that we can get them earlier on through palliative care, we may be able to actually meet some of the goals of the families of where they're at. And so with the pilot program, it's a 5-year program. We started in 2018. We're in our 3rd year of the pilot program right now. It'll end in 2021. Unlimited patients can come on, and the idea is to really give patients another choice. They may have a terminal illness, but if they want to seek more treatment, they want to seek some more time, they want to have something in the hospital done, they can do that without having to elect their hospice benefit. It's a wonderful, wonderful, innovative program, and what we're hoping, I should say what CMS is hoping to find, is a payer source that's going to actually pay for palliative care just like it does hospice right now.
Right, and so the idea is, I mean, a couple, if I remember, our conversation when this was launched, is people more comfortable at home with an environment, supports that are there, but accessing kind of the care in a different way, and ironically that's cheaper.
Yes, absolutely. Because what we find is that families, they're looking for just a little bit longer is usually what it is. A lot of our patients are looking to make it to a graduation or a wedding, so they don't want to give up on chemo. Even though they know there's not really any more options left, this is another option for them. It's a way to be able to say, we're going to give you the nursing care, the social work care, spiritual care that hospice would bring, but we're not going to ask you to give up anything that you're already getting. We're giving you an extra layer of care, which makes better outcomes for our passings. And so I think that what we're going to find, our numbers have grown over the past year. We have healthcare providers in the area that are excited to give their patients a new option besides hospice. It used to be hospice or treatment, and that's it. We're kind of the go-between right now. And what we have found is a lot of our patients, they do end up going on hospice a lot earlier. About a third of our patients go on to hospice earlier than they would have, because now they've got the support of a team that's able to help them make decisions.
Petty program?
PD program.
PD, okay.
Oh, my program.
So the Pediatric Palliative Care Program, I'm the director of that program. It is a program under the Department of Public Health. It's under the umbrella of the Children with Special Health Care Needs. We have been in existence since 2007 as a state program. Notre Dame became involved in 2012. We service children under the age of 19 all through central Massachusetts and now up in the Merrimack Valley area. We expanded last year into the Merrimack Valley area. Children with life-limiting illnesses, diagnosed with illnesses that are going to prevent them from making it to their 19th birthday, pretty much. And it's music therapy, massage therapy, social work, spiritual care, all of those services, child life specialists, all those services provided free to the family. It does not interfere with their insurance. And we are constantly growing as a state program. We're constantly going back to the state government, asking for more funding, and we're growing every year. So it's been a wonderful couple years to be part of that program.
Well, we got a lot in.
Yes.
And Notre Dame Healthcare, people want information, online presence?
www.notredamehealthcare.org. We also visit our website. We, if you ever need to call, we are at 508-852-5505 is the hospice. And because we're all under the umbrella, the thing about Notre Dame Healthcare, they can call a number, get on a website, and we'll get them where they need to go.
Right.